Now, a group of Sussex GPs is so convinced of the health benefits of singing, they actually prescribe it for patients. The Brighton Health and Wellbeing Centre, which is an NHS GP practice, was one of the first in the country to prescribe arts programmes to improve patients' mental and physical health. Now the practice is trying to raise more than £100,000 to help prove its impact. Our health correspondent Mark Norman has tonight's special report.
It's not every day that patients in the waiting room at your local GP surgery burst into song. And ask these patients why they're here, and you find out they were prescribed the singing sessions by their GP.
The doctor ordered it.
Tell me about that.
I had a heart operation and I was coming here, and then they said, come, it's good for the heart, the lungs, the mood, everything.
Come because it's really uplifting, and in the past I've suffered from depression, and singing just lifts my spirits.
I had pneumonia very badly, and this is one way that I want to be sure that I reach down into the depths of my lungs to keep them clear.
What I think every GP would agree with is that often we feel we're medicating isolation, loneliness, lack of community, and that feels really unsatisfactory. Patients keep coming back. Citalopram is no substitute for friends, community, sense of well-being.
The NHS says there are 5 ways to improve your well-being. Connect with other people, be active and make an activity part of your life, learn new skills, give something to others, and finally, be mindful. This practice is now fundraising to both continue the classes and gather more evidence that it works and prove to local NHS bosses that this type of prescribing can actually save the NHS money in the long term. Mark Norman, BBC South East Today, Hove.